Welcome to CEO Money. I'm Michael Yorba. Thanks for joining us. I have Lee Horner, CEO of Synzi, on the show with me today. Lee, welcome to the show.
Thank you, Michael, for having me.
All right, great. Lee, I know you're doing a big push here in Texas. You're going to do a big rollout. Before we get into all of those conversations, I'd like you to give our audience an overview of what Synzi is, some background on you, and then we'll dive right into it, okay?
Sure. So Synzi is a newly formed entity that we founded in January of 2018, but we actually got our start, and I founded the organization within my sister company, that is Stratus Video, which is a video interpretation company, in March of 2016. So we've really been in business now about 2.5 years. Our primary focus is the focus around doing virtual care. That's where we got our start, and how to provide better experience from a video perspective out to patients, whether they're, in a market that is widely available or a regional type of market that has, limitations around technology use, bandwidth, and such. Our goal really was to kind of focus on delivering that high quality video to patients and providers. And since then, we've obviously expanded past that. We do more than just video communication today. We have a communication platform that consists of multiple modalities. So instead of just focusing on video, we provide different modalities that support patients in different needs.
Let's walk through those. What are they?
Yeah, so they're obviously video. That's our core competency. We also, inside our applications, provide or audio communication. We provide text messaging and SMS, and we also provide email today. So we have a pretty wide variety of modalities. In the future here, we're also releasing our secure messaging component within the app, which will, again, kind of take us to the next level. But we've really focused on trying to drive those modalities so that patients have choice. And those choices are what's the most effective way for them to communicate with, either staff or physicians in order to get the quality of care that they need.
Got it. Discuss Synzi's information as a new and separate entity from the language services company. And I'd like to walk through that part.
Sure. So as I mentioned, in March of 16, I founded Stratus Video, the telehealth division within Stratus Video itself. In late 2017, I went out and secured additional capital to form its new entity. We had such great growth on the Stratus Video telehealth side that our private equity group, Kinderhook Industries, decided that they would make an additional capital investment. We formed that entity. So in January of 2018, we formed Synzi. We basically, have since then just continued to explode in the marketplace. And, we took on that capital and we've expanded our organization, I guess now about 200-fold from an employee perspective. So we're constantly growing both with our personnel and our customer base.
Tell us about the award you recently won.
Yeah, it's a great accomplishment with the team. And I think it really starts with us really delivering high quality care to patients. So when you look at the organizations that were nominated for the award, I think there were a lot of great organizations out there. I think, the reason why we were selected in the winner of kind of the Innovation Award is we really take initiative and focus on the patient first strategy. And we believe building technology that's easy to use for both patients and staff in order to do that really kind of put us in the forefront of being able to secure not just that award, but other nominations and opportunities to supply high quality technology both to patients and organizations across the U.S.
You're also a member of the Texas Association of Home Healthcare and Hospice, and I'd like to know more about that.
Yeah, so, one of the big things for us is kind of working from the bottom up. So we believe that in order to have good partnerships and relationships with organizations and individuals, you really start at the association level and you go out and you build those relationships, again, kind of ground root up. And, we focused hard on that. And some of the areas that we see great opportunities and have seen great opportunities in the Texas area is to build some of those relationships and start really driving, that care into the marketplace. The beauty of the home health organization and association is really that's where the rubber hits the road for patients. And when you think about, individuals that whether they're in need of hospice care or palliative care, the idea of being able to deliver a high quality value service to them that simplifies their world is an area that we just find, probably at our root cause of who we are as a company. And joining organizations like the Texas Association is one of our key strengths and one of our key driving forces moving forward. It's just really to go out and to build partnerships and relationships with those community, both the organizations that are running them and the individuals that need support of that technology.
What's next for your company?
Yeah, so it's a great question, and it's an area that I constantly focus on. I don't think you can ever stop thinking about what's next. I think the area that we're really focused on right now is looking at that data and really understanding how that data impacts people. So some examples around that is not just the engagement of figuring out, whether you want to send a patient a notification via text or email, or, how they actually use the application. But it's really to start looking at cohorts of those populations and identifying the best way to engage and communicate with them. So some of those areas there may be certain cohorts that, based on different demographics, whether it be age or race or whatever it is, you look at those demographics and you say, over time, how do they behave as individuals and groups? And to really start to focus on how you send notifications and leverage technology to support those individuals is going to become critical. The hardest part of all of this is engagement. And if you do it right and you understand how those patients and members want to be engaged, you start to have higher adoption and higher engagement.
When you say use technology to better engage with them, give us a breakdown on that.
Yeah, so that goes back to using applications around, the timing and the execution of video calling, for example. The idea of being able to do secure messaging. So it's not just about, putting a bunch of content and information in front of them. It's about doing it at the right time with the right modality, with the information that would get patients to take the proper action, whether that's, just a follow-up video call to make sure that, there's nothing going on with them from whatever, work or surgery that they may or may not have had done, to just a check-in to, confirm and maybe send them some content that's a video that gives them some articulation of, some of the things that they should be aware of as they go home and transition from either, a hospital or some form of health system.
Brilliant. Yes. I wish I would have had this when I was taking care of my wife with her issues, because it would have been a lot easier on the person that, the caregiver. I can see that this is a massive help.
Yeah, and that's an area, you mentioned caregivers. That's an area that we really focus on as well. It's not just about the individual that needs care. It's the ability to be able to connect and access the caregiver that may or may not be readily available with the patient at that time. So some of our technology and our focus is, how do we bring those caregivers into those conversations? And what we've really developed from a technology perspective is the ability to simply have a patient be able to access one of their caregivers, family members, through our platform with a simple click of a button, without having to either get them on the phone. But now you can visually see those patients, or see the caregiver and the patient simultaneously, and have real conversations about things that may need to be discussed in regards to future health or needs.
Or what their current status is, because you can say, I'm fine on the phone, but when somebody's looking at you, no, they're not that fine. I need to get over there and take care of something.
Absolutely. Absolutely. And the ability to bridge those three gaps of, whether it be physician with patient, now physician with patient and caregiver, it really, it closes those barriers that we're all fighting every day to try to make sure that we provide the best care.
Are you growing the company organically with your investment banking behind you, or are you also looking for additional capital for further expansion, more engineering, more architects on the software side, things of that nature? I'm wondering.
Yeah, I'll never say no to wanting to partner with the right partnership. Today, we have a great relationship with Kinderhook. They're a great partner. They support us in every way. I always think there's opportunities to continue to grow. They've supplied us with plenty of capital to do what we want, but I also think there's some strategic partnerships that over time make sense. and the ability to, allow organizations to maybe make investments into us that will help, accelerate some of their personal goals in regards to companies is an area that I'm personally looking at to, continue to grow and move forward with.
Got it. Lee, thanks for being a guest on the show.
Thank you very much, Michael. Appreciate it.
You're welcome. You've been watching CEO Money with Michael Yorba. Like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.